you may or may not know that as women age, the amount of hormones that their body naturally creates decreases. So why are doctors so afraid to replace what is lost by prescribing hormone replacement therapy? To understand this, we have to talk about the Women's Health Initiative, which is a study that was conducted throughout the 1990s that really informed what we have previously understood about hormone replacement therapy and its safety. I think that this infographic that was created by B Power Fuel is fantastic, and so I'm going to use it as a reference point. Make sure to follow them and check out the rest of their content. So to this day, the WHI is one of the largest studies that has ever been conducted on women. The data was collected from 1993 to 1998, and it really drastically changed the way that we approached hormone replacement therapy in women. In fact, we actually stopped doing it altogether because of some concerns that were raised due to correlations that were associated with breast cancer, cardiovascular disease, and stroke. In years after this, we've taken a really close look at this data and now have a lot better of an understanding of what we were interpreting then and realized that some of this may have actually been misinterpreted quite a bit. And so let's talk about that. So something that is really important to understand about the WHI is that when this data came out in 2002, it was largely misinterpreted and overgeneralized. And so basically, there was an arm of this study of patients who were getting hormone replacement therapy in the form of combined estrogen and progestin, which was a common combination at the time of what was being administered to patients for HRT. And what they found was those patients were at increased risk of heart disease, stroke, and cancer. However, the patients that they were looking at were all older. They were all at an average age of 63. When they went and actually looked back at patients who were in their 50s, which is typically the age that we start hormone replacement therapy, not in the 60s, they actually found that there was a completely different risk-benefit profile that had not been acknowledged, and so we were kind of overgeneralizing this data to not describe the population that it would likely be affecting. So we have these hormones for a reason. It's not like our body just makes them for no reason. And so after we scared an entire population of people and generations of people about hormones being bad and scary, we went back and looked at this data and found out that timing really is what matters. And so if you start hormone replacement therapy close to the onset of menopause within 10 years, there's actually evidence that shows us that there is a protective benefit and it can actually be healthy for your heart. It can actually prevent atherosclerosis progression, which is those plaques that cause heart attacks and strokes. And so we ignored this before and just told everyone that hormones were bad, and to this day people are still scared to prescribe hormones. There's a whole lot of information to cover with the WHI, so I'm going to be making a part 2 to this video. Follow my page and like this video if you want to see that.